So in part 2 of chapter 2, we're going to still talk about what to do in case of an emergency. So after you have assessed the situation, you have to determine whether or not you need to transport the patient immediately. So there's certain things to look for. If a patient has difficulty breathing, chest pain or abdominal pain, very rapid heartbeat, feels faint or is unresponsive, has difficulty speaking, numbness, weakness, dizziness, confusion, or changes in mental status, any type of unusual behavior, such as difficulty walking, or if they have sudden blindness or vision changes, bleeding that's profuse and won't stop, any type of compound fracture where broken bones are visible through the open wound, any type of drowning, choking, severe burn, a severe allergic reaction, if you notice extremely hot or cold body temperature, or if the patient has been poisoned or had a drug overdose. These are very, very severe reactions and need to be treated immediately. If there's sudden headache or a type of headache that is different than any pain they've ever had before, persistent vomiting, diarrhea, coughing, or vomiting of blood, or any type of wounds that seem severe enough that need immediate medical care, you need to call 911. So even as you're assessing the situation, you as a first aid responder are not trained enough to handle these type of medical emergencies. You have to activate the EMS system immediately. And if you move any of these people, you could be hurting them. So you need a trained personnel that is experienced in this type of injury. So calling 911 is the best thing, and getting an ambulance to that person immediately will get them to the hospital more quickly. Most communities have 911 to receive emergency assistance. When you do activate EMS, you must speak slowly and clearly. Be ready to give it the following information: the person's location, your phone number and name, the description of what happened on the scene, how many people need help, and what is that person's condition. But most importantly, do not hang up until you're instructed to do so. Some tips to remember regarding 911. You should teach children when and how to use 911. If you call 911 accidentally, don't hang up. Explain to the person the operator, that you accidentally dialed 911, because if you just hang up, they may then try to trace your call and find out because they think it's an emergency, so you're just wasting their time. You want to make sure you have EMS, fire, and police numbers on your phone. Sometimes with rescuers and first aid providers, it's not unusual if you have adverse physical reactions during a medical emergency. Sometimes desensitization training can be effective in eliminating fears and anxieties that can occur when you see these type of tragedies. Post-traumatic stress disorder is something that can occur as well. So sometimes you need to be treated for these type of things in the beginning as you're learning to give first aid. You have to size up the scene. Think about, once you get there, you have about 10 seconds to scan the area and see what's happened. Ask specific questions. Are there any hazards present? How many people are injured? What is wrong? What happened? And are there any lay people, bystanders, that can help us here? As you approach the emergency scene, you have to look for hazards. So if you see a tree that has fallen on some lines, electrical lines, and you know that could be a dangerous thing, that's something you have to determine right away before you even look at anything else. Try to determine what was the cause of the injury or illness for the person involved, and determine how many people are involved so you know how much help you need. So that is it for the second part of chapter 2. We'll continue on in the next video.